And this is Tanya Sherry from Health Leadership and Learning Network here in Toronto, York University. Um, there will be no slides. Rosemary Kohr will just be talking to you from her office, and we're glad to have you part of this as well. We'll be asking people to ponder on questions they may have of Rosemary or even of each other. It'll be a collaborative um, discussion today, but we'll be fielding questions to Rosemary Kohr for her to consider and comment on. And but please also put in your thoughts about patient navigation as we have this discussion. We're hoping this will be a nice organic discussion. Okay, I think we are. How about we start, Rosemary? We're at 1:05. So I'm going to do
Sounds good.
Great, thank you. Welcome, everyone. We're so glad to see you all, and I hope all is doing well for you and your families during this time. Um, we have a lot of people joining us today from across Canada. And because it's a topic of patient navigation, it's and health navigators as well. It's very dear to us here at York University and Health Leadership and Learning Network. So we're so glad to have such an overwhelming interest in this. Hello, I wanted to confirm that there is no audio, right? Exactly. There is no audio for participants, but please open up your chat, your group chat for Zoom, and submit your questions, thoughts, and we're going to be fielding questions and with Rosemary as she sort of positions this burning question for us today. Just a few bits of etiquette as well. The session today is being recorded so that it can be used for people to continue to access. So we'll make that available to everyone who's signed up today. It's important that we, share ongoing discourse in patient navigation and healthcare navigation as we all build this area within our healthcare system. I myself am Tanya Sherry, and just wanted to make sure I see lips moving, but everyone is muted. Yes, everyone is muted. I hope you can hear me. I've got Ishrat Khan. I hope you can hear me. So I'm Tanya Sherry from the Health Leadership and Learning Network here at York University. I'm the director of hlln. So Rosemary Kohr is the founding program director for our Patient Navigator or Health Navigator program. And Rosemary is an RN, PhD, as well as a nurse practitioner. And she has developed this program in collaboration with us here at York. Rosemary is a consultant, an educator, a researcher, as well as a program planner. And she's worked with not only the Ontario Long-Term Care Ministry here in the province, but also the Nova Scotia Department of Health and Wellness. She's been a corporate lead in wound care, corporate program lead, in wound care and ostomy and continence at such organizations as St. Elizabeth Healthcare. She's an advanced practice nurse wound care specialist as well. She's the past president of the Canadian Association of Advanced Practice Nurses and an adjunct professor in the Faculty of Health Sciences at University of Western Ontario. She's also our program director here here in Health Leadership Learning Network for not only our Patient Navigator program, but our wound care program as well. So you may have seen her in wound care. So I want to welcome Rosemary today, and I'm going to switch the presentation over to you.
Okay, thank you. I'm hoping that everyone can see me and hear me. Let me know if you let the chat line know if you can't. So today, our thought was really to reach out and create something a little bit different in terms of a webinar. We often think of webinars as being something where they're a little bit more didactic in terms of, learning. And I noticed somebody was asking about slides. And so what we decided to do was really offer something that would be a little bit more dynamic. And as Tanya said, organic. in terms of really getting a sense of what this experience with a global pandemic that we have never had before in our lifetimes. How are we managing? What are we able to do with a patient navigation lens? So, really looking at this from the current situation. So, what are the kinds of ways that patient navigation can provide support? And also thinking down the line, what is this going to look like? We know this is going to be a different future. And how can a patient navigation program or a role help that develop so that we have optimal health for our patient population. So I wanted to start off with just a little, some observations in terms of, what this looks like and what this means. I don't know how many of you are listening to or watching the Prime Minister with his daily briefings. But, it's something, even if you don't go on every day, it's certainly something that helps to provide some understanding of what the federal government is doing around supporting Canadians, and also really giving I think, a pretty accurate perspective on what this is going to look like and what this is looking like from from a societal perspective in our country. And I don't know if you're like me, I'm a sort of statistics junkie, and I don't have sports to watch, so so I'm kind of stuck. But I do tend to look at the stats for uh, it's not a laughing matter, obviously, but I tend to look at the stats for COVID-19 and how this is looking across the world. What are the kinds of things that are going on across the world, and looking at it also from the perspective of colleagues and friends and family that I have who are in other countries, and what are the kinds of experiences that they're having that could potentially impact on our ability to maybe learn from some of the experiences that other places have had. So part of what I think in terms of patient navigation, and I don't know, some of you may have been part of the courses that I have offered through York University on patient navigation. But really thinking about the role of a patient navigator and the role of a patient navigation program in terms of being able to, reach out into the community, to be a liaison, a link, a broker. I use those kinds of terms when I'm talking about what it is that patient navigators do, because it really is a different kind of role from a traditional sort of coordinator, care coordinator, or discharge planner. There are a lot more facets to the role that I think we need to pay attention to. And in this very different world, what does that look like? Some of my thoughts around this are from my own experience working at London Health Sciences Centre during the SARS epidemic. And what was required at the time from healthcare professionals in terms of the gowning, the gloving, the using masks, making sure that our N95 masks fit properly, face masks, being able to run interference with patients and with family members, because we were, again, restricting family members in visiting the hospital and in visiting their loved ones who were in as patients. Um, but, we went home. I mean, I was thinking about this and I thought, I went home, did all the necessary sort of sanitizing, etc. But I went to the grocery store. I went home. I had kids. I, talked to my friends. I probably had dinner and drinks with friends. Didn't have the same impact as this current pandemic this, virus that we're experiencing. And I think that that's one of the big, it's a big difference, but it's also something that has colored the way we are able to respond as healthcare professionals, and also the way people are seeing what's going on. This is something, if you are in self isolation, how long have you been in self isolation? And how much longer is this going to go on? What impact does this have on use of the healthcare system itself? I heard this morning a physician from Prince Edward Island talking about the fact that that people were reluctant to make doctor's appointments or come in to see doctors for a variety of things. So what's going to happen, down the line if people have not been seeking help for particular situations? So, I think these are all different. It's not the same. And one of the sort of two questions that we were asking were around, what are the challenges? And so this to me would be painting a bit of a picture of what those challenges look like for us in healthcare, and for us who are in the role of patient navigator, or who feel that this is something that we still need to be, really on top of, because frankly, it's probably one of the key things that we can do. Patient navigation is all around being able to smooth the process, the transitions for people. So my thoughts on that are, what are the challenges around making those transitions happen? And when I looked at the different environments that you work in, so last night I was looking over the participant list to sort of see, where are people located and what are their roles. What struck me was there was wide variation in terms of, where people work. So your job may be in a clinic setting where you have kind of a routine that you're able to use with your patient population around setting up appointments, following up with people, reaching out in the community, or reaching out to the hospital setting. But now all of that has really changed. And, I think one of the things that is valuable about an event like this is it gives us a chance to really look at some of the things, the challenges that people are experiencing, but also some of the ways that you are adapting. Because again, healthcare providers, we tend to be pretty adaptable. We have to, you have to kind of make do often with what's around. So, that's one of the things that I would be really interested in. And I think as a group, a collective kind of way of looking at, how are we managing here? And, I'll give you an example of sort of why I think this is really valuable. So from a personal perspective, I have family in Europe. So I have family in Milan, which is, was one of the sort of epicenters of virus. I have relatives in Paris and in Switzerland as well. And so we decided that we would have a Zoom um, conference, like a teleconference or video conference with my family members who were all, I would say, in their late 60s, early 70s. And and it was really quite funny, to sort of get people online. But the thing that was really interesting was listening to them talk about what this experience is like for them and how they're coping. And it made me think about, the kinds of, as a nurse and as a healthcare professional who's worked as really before things were called patient navigators, but really in that kind of role, to really think about what are the sorts of resources that we can uh, make available, and that we can challenge ourselves to support people so that the levels of stress are decreased. Because I think that's one of the big things that is, that is affecting everyone. And when you think about your own lives and our patients' lives, where now not only are they dealing with whatever their chronic disease is, or their follow-up care for cancer care, or their follow-up care from having had a baby, or whatever the situation is that they are in. They've had a stroke, they've been in hospital, whatever the situation that they have been in, they're now dealing with being isolated, and they may be isolated with children at home who really are not that thrilled with being without their friends, for example. So, you've got all of the constraints. You can't just kind of run out to the grocery store to pick something up. Um, all of these constraints that people are experiencing have an impact on how we can support them. And really, I think that's the bottom line, is to be able to provide support for patients in this time when a lot of people are still asking questions about, what should I wear a mask? Do I wear a mask when I go to the grocery store? What about, this is Easter weekend coming up and it's Passover? So how are people saying, well, if it's just my family that comes over, that would be okay. So, how are we able to help as patient navigators, help people navigate through this particular crisis, which is huge?
Rosemary, I wonder,
Yeah,
oh, sorry. I wonder if I can field you a few questions.
sure.
Yep, great. Because you've illuminated a number of areas here, one of which is possibly the scope of the patient navigator is ballooning temporarily, because they're taking on more of a support role as well. So if any of our participants are currently navigators or thinking about it or have been supporting navigators, feel free to comment in the chat line about what you're doing as I'm talking about this. But Rosemary, do you think the scope of the patient navigator is actually increasing, ballooning temporarily, perhaps in that providing coping support, providing reassurance, perhaps access to alternate resources? And is it temporary? I mean, the secondary question is, do you feel it's temporary, or is this actually should be within the scope of the navigator anyway? And that's what they would normally do. And then you really pointed to another functional situation for navigators is, how are they functioning? It used to be face to face and it can't be anymore. So the use of technology, is that what they're using, or a telephone, or what are we all using, or what should we be using to now still communicate with people that we're supporting as navigators? Sorry, two-part question. What do you?
Yeah, I think I think that as Alexandra is saying, a lot of the change in the role has been to something that is providing not just sort of connecting, but actually being in that supportive kind of role. And the reason why I think patient navigators are in such a, ideal, I suppose, situation to do this is often the patient navigator is the one consistent voice or the one consistent face that people see across their healthcare trajectory, whatever it is that they're involved in. And I do think that as Marlene is saying, in terms of that phone, I'm sure that your ears are exhausted. And I think the other part of it too is to really be encouraging your patients and the people you work with to consider how they can use technology. Because, I think there are a lot of alternatives to, there are a lot of alternatives that incorporate using things like what we're doing right now. So, having, now granted, I'm the one, I can't see you, you can't see each other. We're not, it's too big a group to do that kind of thing. But, when you're having those conversations with your patients, and you're helping them where you might ordinarily, like you say, be in physical proximity with them, but you're not at the moment. They're at home, or they may be, somewhere else in the building, for example. But to have that FaceTime, we talk about communication skills, and we certainly talk about communication skills so that you can call people on the phone and have those conversations with them. But it certainly has a big impact on people if they can actually see you. So I do think that that's another sort of thing to get over in terms of being afraid of the technology, or thinking, oh, how can I use this? Remember too to think about that circle of care, so that when we think about from a confidentiality perspective, that you want to just make sure that you're kind of maintaining those parameters, but that the circle of care is something that is identified as the people that are involved in the care of that person. So it could be the pharmacist, it could be the social worker, it could be yourself, it could be the physician, it could be the nurse that you're working with. So, all of those players can be on board, and, using some kind of a chat format, Zoom or something else like that, works really well to be able to have those meetings so that you can talk to each other. So I know that there are some other comments here.
Yeah, we have a lot of them coming in.
Yeah.
Thank you, everyone. Thank you. Thank you so much for
which is
sharing.
great. The other thing I want to say is that, I was, like I said, I was listening to the Prime Minister this morning, and just looking at the statistics, and sort of the trajectory, the anticipated trajectory for what's going on. This is not going to be over soon. Much as it would be nice if we could say, it'll be the end of June, which is what, sort of the thought was the end of April, and, now sort of the end of June. But there are also conversations about the likelihood, the projections that are coming out of the public health, saying that the likelihood is that while if we can really stay on top of this, and I think that's the other message as patient navigators, is to really get that message out to people that, that social distancing, that things like this weekend, no, you're not, just because they're family members does not mean that they can come to your house. If they live in your house, fine. If they don't live in your house, no, they can't come. I mean, that's just, you have to figure out other ways of getting together. So Zoom or whatever, talk on the phone, for people who don't have the internet, they can talk on the phone. So being able to, I think the other thing too is, as patient navigators, one of the things that we do is we need to be reactive and responsive. So we need to be able to say, okay, technology is clearly an important factor here. We need to really pay attention to ensuring that people are comfortable with technology. So how do we do that? Well, if they've only got a telephone, then one of the things that we can look into is, do the phone companies offer conference calls? And would the phone company, Bell or Rogers or whomever, would they offer conference calls as a free service for people who do not have any other way of communicating? So then you could have, somebody could then have an elderly person who is by themselves, could then have a telephone conversation with their daughter, their son, their sister at the same time, even if they don't have the internet, because, most people have a telephone. So that's something, as patient navigators, that we are advocates for our patients. That's a place where I think that's a role or an add-on to the role that can really be a positive thing for the community. And again, thinking that, what is the purpose of what we're doing? To keep people healthy, to streamline the healthcare system. So that, to me, works in that direction. So let's look at some of the things that people have been posting. Tanya, do you want to?
Yeah, let me go through them. And I'm also making some quick notes to summarize. I hope I'm going to capture all of this, what people are saying, that I will try and put up and share before you all leave, and then we can send them out too, because you've signed up. So we've got your emails, and we'll send these to you, because people have got some really fantastic ways that they are addressing the communities that they provide navigation to. And so we've got they're actually recruiting other team members that are also sort of stepping in as navigators.
Right.
People are adding in additional communication channels so that there's more consistent communication. I noticed someone from Cambrian College, they've set up a landing page. So there's additional clear communication with their students. They're also taking more direct calls from, say, clients or, say, students, if it's students that are involved, or maybe patients, clients, more direct calls directly to them. They're invited to connect if they're feeling stressed, to have a conversation. I've got people who are proactively connecting with clients and patients, sort of really anticipating their needs, talking as a team. What is it that they need? They're also advocating. They're considering people who are more vulnerable or isolated, people who are seeking access to services, and sort of anticipate those needs in advance and make sure people can get access to services that they're going to need. A lot of increasing the scope, which seems to be just fine with everyone. And yes, this may mean, that the scope needs to increase permanently. So I've got a question here. Our team, our patient navigators, have been operating face-to-face and remotely for several years as nurses. Right now, we are doing remote check-ins as well. But on a plus side, other IHPs and other team members are starting to do more navigating under the current COVID. Can you speak to any specific assessment questions that help?
Mm-hmm.
And that's
Yeah, and actually, that's a really good question. One of the places that provides really excellent support is the Registered Nurses Association of Ontario. So the RNAO has I think it's every 2 days, they post a bulletin. It's actually Doris Grinspun who is doing this. I mean, she's doing an amazing job. So she's posting every day some information, current information. But one of the things that that they have posted on that website are the links to public health, and the links to the assessment questions that people can be asked around COVID-19. So there are sources. So there's, there's the just in terms of the Canadian public health. And the other thing too, we face this all the time, right? About, people will ask us things about, well, what about oil of oregano as a something that works to keep the virus at bay, or different things. And there, CBC also, and other radio stations, but I mean, I think CBC has done a really good job in terms of looking at some of the myth busting kinds of things. There are some new reports that have come out from was a new study that was done recently in the Netherlands on distances between people in who are walking or running, for example. So people who, are practicing, are running outside or cycling. I mean, as the weather gets nicer, that's the other thing I think around patient navigators. Somebody mentioned in terms of being proactive. And I think that that's the other place that we really need to pay attention to is, what are the challenges that we are going to be facing when we look at the summer, when we look at as the weather gets nicer. I mean, in Canada, we're sort of, unless you're, I don't know, maybe living on the West Coast somewhere, but for the most part, it's really, we have such a short window when we can go outside, and it's nice. So what is this going to do as people are being told to, social distancing, and to think about, if they are participating in activities like running or cycling, how much space should there be between you? And like I said, there's a new study that just came out. So, that's something else that we really need to be on top of, so that we're giving the right information to people, and so that they understand that, what does it mean? For example, the Prime Minister this morning said, he was talking about kids, and he said, kids should, keeping your kids indoors. Well, that's not exactly accurate. It's not that you're not letting them outside. It's that you're not going to playgrounds or places where they're going to be around other children. If you're in your own backyard, or in a space where there are no other, you're at a 2-meter distance from people, that's what you need to be able to tell people, so that they understand, what exactly does it mean when I'm told I can't go out? Because, people have different perceptions on, what am I supposed to do? Or they think, oh, I don't have any symptoms. I can just go out and carry on my ordinary day. And I'm sure you've seen people who are out like this. So that's part of, I think, what we need to think about as patient navigators, is getting the correct information out to people.
Rosemary, I have another question I wonder if we could address. And someone's made a comment that taking these, as navigators who work in the community, we're more focused on finding resources and helping clients to get access to those resources. So as I understand that, it's alternative resources that this person may be talking about that are not necessarily what they were originally doing as the navigator. For example, she goes on, or this person goes on to say, food banks, like some of them have closed, and some other initiatives that have been created perhaps in their place that provide support. And I was also thinking of, maybe there's spiritual support that as navigators you may need to help people seek out, or maybe access, yes, to food banks, or other community resources that you wouldn't have done before, but now you need to help them with. So your thoughts on sort of that expanding role into accessing or networking more into the community to
Mhm.
support the people you
Mhm.
were helping as a navigator.
Right. Well, one of the things that I stress in the patient navigation courses is the characteristics of a patient navigator. And I think one of the really key characteristics is that willingness to explore, to not just kind of, you have a set of approaches to use, but that you really always need to be looking at what else is out there. So part of that is to be phoning places, phoning religious centers, phoning food banks and other charitable organizations, homeless shelters, and talking as collaborators to really identify what are resources that are available or what are resources that could be available. Because as I said before, the phone company, and I don't know this because I haven't looked into it, but it would be one of the things that if I was working with a population where I thought, there are an awful lot of patients that I see who don't have the internet, then I would be calling Bell and saying to them, do you offer this as part of your service? So people have, the conference call uh, service, or is it something that in the past people have paid extra to have? And if they have paid extra, then why don't they waive that fee? As other organizations have, do your patients know that, for example, some of the car insurance companies are dropping the premiums because people aren't driving. So, those are places where, as patient navigators, you really can be, a navigator is somebody who knows where all the rocks are and who can steer around the rocks. Well, we've got some new rocks. So how do we ensure that our people get safely to where they need to be? And that's, at home, safely at home, not sick, etc. So those would be the kinds of things that I would be thinking about, would be, make a list of what's out in your community that you could phone, people that you can access. And maybe even putting people together in terms of a Facebook, somebody mentioned something about, having a group in their, uh, like at the college, for the students, for example. So what are some of the other things that we can really look at? If you're dealing with people who are immigrants or, refugees, there are a lot of international students I know who are, in fairly dire straits and who are, how are they managing?
We've
So
got
contacting health services at the university, what's going on with in that respect.
Rosemary, we've got some people submitting along the lines of that telephone or access to a phone, and then your hydro. People have said hydro has offered flat time rates from March 26th for 1 month to help with COVID challenge. Mary Ann Smith, if you could let us know what province that is, that would be great. And I've got someone else has said Rogers has eliminated overage fees. Bell has not, as far as I know. Again, whoever submitted that, can you let us know if you know if that's limited to a particular province or not? And Ontario Hydro, Marianne, regarding the hydro, it's Ontario Hydro has offered flat time rates. So again, something for you navigators, and for Rogers, it's Ontario as well. Perhaps the other provinces have already followed suit. Another person has said you can apply for OESP online. Subsidy is available. Like everyone This is great. Thank you. There's so much here. There's something I wanted to, though, go back to, Rosemary, and ask you a question about primary care. Somebody has submitted a comment. Currently, there's no way to identify the patients at risk who would benefit from navigation. Primary care providers do not always know who is not managing well, and individuals would not normally reach out to their providers for non-health related issues,
Mhm.
assuming they are not familiar with the determinants of health. So any thoughts, Rosemary, on how we can support the work in primary care, perhaps even by reaching out to, say, primary care? And can I also lump in geriatrics in that, for
Mhm.
how we can additionally support geriatricians whose clients or patients may be, residing in the community, uh, and people who
Mhm.
are hidden right now but are at risk?
Well, I think that, it's that hidden population for sure that is at high risk. Um, and, it's one of those opportunities to engage. Somebody mentioned about other people in their organization taking on some of the patient navigation roles. And I think it's one of the places where we really need to begin to say, this is the potential is there for lay navigators to help out, to participate in having maybe a little list of interview questions, calling people. Everyone is at home. Where are they? If they're not at home, where are they? So most people are going to be at home. And on that, the patient roster list, I know it could be 3,000 people, but out of those 3,000 people, you can probably winnow down to maybe, I don't know, 2,000. So if phone calls are made to those patients or those clients, just check in. A week's worth of phone calls to people would really help to be able to see what's going on. And it doesn't require, it doesn't necessarily require a huge amount of time, but it could be something that could be divested in a way uh, to lay navigators. So this doesn't, you can have a patient navigator who is a healthcare professional who is overseeing a group of lay navigators and ensuring that when they're making these calls that they're doing what needs to happen. But why not set something up so that every person gets a phone call? I mean, how difficult is that really to do? And given what it would do to ensure that we are potentially catching people that otherwise would be lost.
Yeah. So to our current question right now, Rosemary, I have, and everyone, we have someone who is adding to this conversation. We reach out to many patients with chronic illness and seniors, anyone at high risk that comes up on our lists. Example, patients with DM, CHF, COPD, etc. Those are the people we are checking in on, over running a search for patients over a particular age, for example, 75 plus. Yeah. So
Yeah.
as I understand that, then they are digging a little deeper into who may be in need of help that is hidden, and let's seek them out. It's an active strategy. And
Yeah.
yeah, and I've also
Sure.
added to our list that we've got daily living needs is another addition to your scope as navigators. The daily living needs, like addressing what's the cost of discounts you're going to get on phone use, on hydro, and other utilities, perhaps,
Mhm.
because these people may be in trouble. The determinants of health may be in, uh, and they're in trouble, and perhaps can't pay the bill, and that's going to impact their quality of life and their health.
Well, and the other part of it too is understanding financially what is available to people through the federal government and through the provincial governments as well. So that's another place where you, as the patient navigator, can ensure that you have accurate information so that you can share that with your client load or your patients and your colleagues so that people know that they actually can get that they can get financial assistance and that it's easy to get. I mean, it's kind of sad from my personal perspective. It seems a little bit unfortunate that, in the past, has always been convoluted for people to apply for employment insurance or for workers' compensation. That's one of my, was always something with patients that it was very difficult for people. And, the government has now come out with this relief fund, which is fantastic. I mean, my own sense would be, this is really, we need to have a living wage for Canadians, and this would be the way to sort of set that up. But anyway, that's my personal opinion. You realize that all of this is my personal opinion. This is not York University or Health Leadership and Learning. It's, Rosemary Kohr. So just so you know that. But I do think that, the fact that that funding is there and that it's easily accessible is important, because people are really stressed. I mean, it doesn't take a rocket scientist to figure out that people are really stressed. So how can we mitigate that level of stress for our patients? And again, people who are alone at home, how could you as a patient navigator, for example, work with a volunteer group who are willing and able to pick up groceries and drop them off at people's houses? I know I have colleagues who have taken it upon themselves to, and in groups, right? This is not sort of an isolated thing, but who have done things like they pick up groceries for healthcare professionals who are working, frontline people who are working. So there are groups that will do that. So how can, tapping into that kind of resource in your community would be something that would really, and if there isn't something like that, how can you perhaps be a facilitator in supporting that to happen? The skills that you have as a patient navigator are skills that transpose when we are looking at these kinds of things. Oh, this is interesting.
Well, I've been keeping track of comments coming in as much as I can. We're gonna have to do a better job and look at the chat when we're done and then send it out. But I've been compiling a list of comments, of what people are doing and trying to categorize them. And I just wanted to show it to everybody so that they can see what we're doing and maybe take a quick snapshot of this. If I could make it a little larger. Can I make it a little larger for everyone without losing the chat line?
Yeah, and I can add some of the resources as well. Like you've got CRNAO.
Yes.
So I have the links that I'm more than happy to, if we're sending this out to people. I think this would be great.
Yep. Yep.
I mean, I've thought, the other thing I've thought about too is, setting up some sort of a Facebook page that would just be like patient navigators, let's talk about stuff.
Right. And exactly. I didn't mean to interrupt you there, Rosemary. We have a number of people also commenting that they're concerned about the misinformation that may be out there. With all the information and misinformation flooding in, resulting in increased anxieties and fear in our communities, where is the best place to direct patients to updated info? And this may be a question to everybody who's on the line. If you've got ideas of where you have found is the best place to go, the information is accurate, where's the best place to direct patients to updated information in our communities? Doctors are completing telephone calls, check-ins. However, misinformation and fear keep them from seeking help, meaning I guess the clients, the patients involved. So if anyone has ideas of who's got some great resources that are accurate, websites, please put them in the chat line and we'll add them in to this document. And yes, I mean, a Facebook page would be great if anyone wants to volunteer. I noticed that Next Jay's on the line. Noah's on the line. I don't know if that's something that Next Jay would help set up and maybe curate for everyone during this time. There, Noah just posted connectedwellness.com COVID. Thank you, Noah, for putting that in. That is the connection to the Connected Wellness platform. Yes, great. Meals on Wheels is not currently taking new clients, only delivering to individuals who are already registered. So I guess we've got some, again, support systems that may not be active. I'll make sure that's in here. So we can't
But
assume that.
again, some of that is going to depend on where you are,
Okay.
where you're located. So I think that's the other thing to pay attention to, is it's dependent on where you are. And the other part of it too is that you could, the other thing that you can do as well is look to see, what are the other options. There are other groups, church groups, for example, that do lots of things in their own church communities. And particularly if you are located in an area where you have a cultural, where there are people who may be from a different culture, or who may have, issues around language. This is, again, something that, how are they getting information? How are people getting information? So that's the other thing that, that I think we need to really pay attention to. I spent a lot of time in the course talking about health literacy. And I think that we need to really pay attention to how are we addressing the health literacy issues that our patients have. One of them is the misinformation side of things. So somebody's telling them one thing, the whole sort of, do people really understand what it means to self-isolate? I don't think so. I think there are a lot of people who still think that their families can visit them because, they're part of the same family, right? um, no, that's not accurate. Or that, how do you, if you're going to get a delivery of grocery delivery, what does that mean? And not to frighten people. There was a video that was on YouTube of some doctor in the States who was showing how, how you should be sanitizing everything. And then Health Canada came out with something saying, well, wash your fruit and vegetables under water, like just use water. And the other piece of that too is, if you can, put your groceries in your garage, like an unheated garage, or leave them in your car for 2 days and then bring them in. So, that works too. I mean, the virus doesn't survive that long in the cold like
And
that.
this,
So
and this may literally be what you as navigators may be communicating in terms of activities of just daily living, right? It's changing. Um, and we're coming to 1 p.m. Eastern EDT. So I want to make sure we can wrap up, and there's so many comments, but I just wanted to visit quickly, Rosemary. We had a comment about assessment questions, and there was one comment that came to me about, can you add in any assessment questions that you would add regarding more rural and remote communities? Patient or health navigators who are working with rural and remote communities that need to modify or adjust their assessment questions during COVID-19?
yeah, that's a really good question. One of the things that I think is important is to recognize that people who are in rural and remote environments, the two big issues are transportation and food safety. So food security. So, and housing, I suppose, would be number three. But, really transportation. So if someone, the kinds of assessment issues would be things around ensuring that, how are they getting their groceries? How are they managing in terms of their finances? How, the sort of additional stressors of isolation. If you're a single elderly person, you're a widow or a widower, and you're accustomed to having your daughter come over to visit, what strategies are in place for people to be able to actually communicate with one another? So, like I said before about the phone line, do they have access to an iPad or to a computer? How are do they have a smartphone? And I think one of the interesting things is that one of the really interesting things is that, we often sort of diminish the potential for elderly people to be, we always think, oh, well, no, they can't possibly, do that. It's too complicated. They can't use, you know, iPads or computers or whatever. And I think what we're finding is that people are pretty resilient. I mean, to sort of end on a positive note is to say, I think we're pretty resilient. We are doing an amazing job. Um, and, putting signs up in your window saying, you know, don't give up, keep going, be strong, like all of those kinds of things. I think that, I mean, my sense is that this is actually, the potential is here for a pretty interesting new paradigm in terms of how we interact and how we live our lives. That is not a bad thing when we come
So,
out of it.
so with that, Rosemary, we are at time, and I'm sorry I have to interrupt it, but I want to make sure that we are respectful of everyone's time. Um, Thank you. We're getting a lot of thank yous and even more thoughts or insights into what ideas we could do as navigators to add to our practice. So to clarify for everyone, Odette is now I'm going to stop my share. We're going to share the notes I've made and try and add more to them from your comments. Odette is going to put on the screen our contact information to make sure you know to send us your email if we don't already have it, so that we can make sure you get the list. Um, Please let us know if you want us to run another one of these webinars. Now that we're compiling this info, we can continue to have this kind of discussion live. And I'm getting, yes, please, for sure. And I mean, tell us, do you want us to do this again? We could do this again in a couple of weeks. When is the next one? Okay. We're going to get the one in, right, Rosemary?
Oh,
Weekly.
sure.
Weekly.
Yeah.
Okay.
Oh,
Great.
right.
Know that we're here to support you as a community of healthcare providers. That's what our mandate is here at York right now and at Health Leadership and Learning. We're also here to try and connect you as best we can. And if someone wants to volunteer for that Facebook page or place to share resources for navigators, please do it. Step forward. You can maybe start something and we can share it via Facebook or how do we do that again, Odette? We could connect you. Maybe since NextJ's on the line, maybe if NextJ wants to curate that, perhaps they want to step into that. I'm not sure. Don't mean to commit you, Noah. But anyway, thank you, everyone. Do you have our emails from this webinar to send out? We do if you have signed up. But just in case you think we don't have your email, please email to hlln.yorku.ca, and it's on the screen right now. Rosemary, do you have any final things to
Yeah,
say?
I just want to add that we have been very responsive in recognizing that we're moving into a new paradigm. And so the patient navigation courses are going online, as are the wound care courses those are the ones that I'm involved in. And I know that there are other ones with Health Leadership and Learning Network, but, just pass the word on to your colleagues that we are working so that we make sure you get what you need.
Yeah.
So,
We're also
and you're all doing a great job. You're all amazing people for what you do. So,
yeah,
just to say.
and know that we're also working on something for people who are not regulated health professionals and doing that as quickly as we can. But also know that our colleagues in our colleges also offer patient navigator programs just in case ours is not something you can get into right now. Marianne, if you're on the line, can you unmute and let people know where they are? Marianne Koh, our programs manager, because I don't want to say the wrong college.
Hi, sorry, I was muted.
Yeah. Can you let people know where the other patient navigator training programs are here in Ontario?
I believe there's a program through Humber College and there's a program through Fleming College.
Okay. Oh, and Melanie says Cambrian College has a 9-month graduate certificate and it's offered fully online. Great, great. For all you navigators who need your education, I think we're all collectively, I don't mean to speak for the colleges and universities across Ontario, but I think we would all agree we're all here to help you and to provide our education in a way that you can access immediately and now. So with that said, we hope to run another one and we will be in touch with all of you. And thank you so much for taking your time to join us today. Please stay safe, stay well, and we'll see you soon. Thank you too.